Step 1 is going to be the Apley back scratch test. Take your right arm, keep it straight, go all the way up overhead. As soon as it is straight up overhead, flex at the elbow, put your hand in the middle of your spine, and then make a fist. Take your bottom arm, your left arm, put it behind your back. Then you're going to go ahead and internally rotate and raise it on up. Try not to drag your hands up your spine, just lift them up as much as you can naturally. Make 2 fists, and then if you have a partner, ideally you do, you're going to go ahead and measure the distance from the first big knuckle on your index finger on both hands. So it's index knuckle to index knuckle. Get that measurement, try to be as exact as possible. And then you can go ahead and relax. Shake it out. And we're going to go ahead and do it on the other side. Notice how that arm stays straight until it gets all the way up overhead. Then you flex at the elbow, the hands in the middle of your back on your spine. And on the bottom arm, you're going to put it behind your back. You're going to rotate it on up until as far as you can. You're going to make 2 fists. Ideally, your scapula are not winging like you can see the right scapula is, but that's a different problem. We then measure the distance between the first 2 big index knuckles again. Be as exact as possible. And you got your measurement. You can see from the side here, when we raise that arm up overhead, you keep the arm straight, you keep it directly in line with the side of your body. Once it's all the way up overhead, you go ahead and flex. Notice how he's keeping his elbow behind his ear at the top. And as you raise it from the opposite, you put it behind your back first, internally rotate, and then you slide it up as much as possible. Try not to cheat it on the way up. Part 2 of our assessment now. On your back, you're going to take your knee, you're going to bring it as close up to your chest as possible. While keeping it as close to your chest as possible, you're now going to extend your leg until your knee is fully extended. Your leg will slide forward a bit unless you have really good flexibility. You then take a stick and measure a vertical line from the middle of that ankle bone, the medial malleolus, right down to the ground. You're then going to take a tape measure and measure the horizontal distance from that vertical line and the greater trochanter. That is the bone on the side of your femur. So if you put your hand on your hip and feel that bone on the side, that's where you're measuring from. If your ankle went closer to the head than your greater trochanter, that's good. You'll mark that as a negative value. You then go ahead and replace it or repeat it on the other side. You're going to go ahead, bring that knee all the way up. Extend your knee out, trying to keep your thigh as close to your head as you can, but you have to make sure it fully extends. Mark that vertical line with your stick, and then measure the horizontal distance to the greater trochanter. Again, if your ankle is able to go past that greater trochanter, your value will be negative. That is a good thing. Once you get your measurement on both sides, you now have all 4 measurements for this test. You will add all 4 values for your total score.